Now, the Ministry of Health and Prevention launched the shingles vaccine last October for the prevention of shingles for those who are 50 years and above. The vaccine, which is administered in 2 doses 6 months apart, supports disease prevention. Joining us now in the studio to discuss more is Dr. Fatima Al Sayyar, a dermatology specialist. Hi, doctor.
Hi, how are you?
Good, thank you. To our first question about shingles, tell us what is it and what causes it?
Shingles, it's called also herpes zoster, which is caused by varicella zoster virus. We all know chickenpox. So it's the same virus that caused chickenpox, and it goes and remain inactive in the nerve. When we grow older, what happens that the immunity gets like weakened. So when there's a stress or immunodeficiency or any infection or weakness or disease, this virus gets activated from the nerves and it travels into the skin, causing shingles or herpes zoster.
Right, so what are some of the symptoms that someone having shingles will face?
Commonly, it is presented as a painful rash, which is like a group of blisters that appears in one side of the body, such as the waist or the chest, and sometimes it can appear in the face as well.
Right, so what kind of treatments are available for shingles?
It's antiviral medication, but nowadays we have something that prevents it from appearing, which is the vaccine.
Absolutely. Now, tell us about specific groups of people who are in higher risk of shingles, like maybe frontline healthcare workers, or who else might be at risk for
Usually, those people who got chickenpox in the past and they have like their immunity weakened, or immunocompromised patients, or also those who are 50 and above.
So tell us more about the awareness that you're trying to build within, the national program for the vaccine.
First, we need to detect the virus and the disease by knowing the symptoms and the signs. Usually, as I mentioned, it appears as a rash, which is painful rash, as well as it can be combined with fever, fatigue, or sometimes itching or burning sensation. Something else that before we have this rash, we get like burning sensation or like tingling at the area that the virus will appear. After that, we need to seek for medical advice within the first 3 days, so the treatment will be more effective. But we have now the vaccine that will prevent from these symptoms, that is having like complications such as post-herpetic neuralgia, which is really painful and sometimes struggling for those people who are elderly. Therefore, the vaccine is usually now is available in the UAE, and they can find it in the healthcare centers, and it is only 2 doses, which is given first dose intramuscularly, and then the second dose is in the second month or after 6 months from the first dose.
Thank you, doctor, for your insight. We've run out of time. Thanks so much for being here today.
Thank you.